Hi, I'm Tori and I'm going to be doing some videos for oral care for mechanically ventilated patients. So the first thing that you're going to do is you're going to knock. You're going to enter the room and identify yourself. You'll wash your hands and you'll apply appropriate PPE. You'll always wear gloves. Sometimes you may need some goggles or a face shield if it's necessary. And then you need to get your patient's vital signs also when you're in to do oral cares. So once you've done that and you've washed your hands and you've applied gloves, the first thing that you're going to do is you're going to suction out your patient's mouth. So what we have here is this little, it's like the sort of like the universal adapter. So this side is going to attach to the suction, and the suction should be -100 to -120, and it has this on and off switch for the suction, and all of the pieces will attach to the top. So first we have the suction catheter. It does come with sort of a protective shield. So the first thing that you're going to do is you're going to suction out your patient's mouth. So you want to make sure that you're suctioning by the gums, by the teeth, around the ET tube as best you can. You want to make sure that we get all of those secretions cleared out. We're going to perform oral cares as a way to help prevent ventilator-acquired pneumonia. And so since those patients aren't able to cough those secretions up on their own, it's important that we are able to do that for them. So we perform oral cares every 2 hours. So after we've done the suction, the next thing that we're going to do is attach the toothbrush piece. I did not get that in my kit, so I'll just kind of talk you through it. But the toothbrush just attaches right here, just like all the other attachments do, and it comes with a little sort of like a toothpaste. And so what you need to do with that is you're going to clean the patient's teeth. You're going to use circular motions. You want to make sure that you're going to get the inside, the outside of the teeth. You want to get back to the molars, inside the cheeks. You want to make sure you're getting the gum line and really getting those teeth clean. You do want to be gentle, but you also want to make sure that you're getting those teeth clean, so you want to make sure that you're not being too gentle, that it's not getting clean properly. Once you've done that and you've got the teeth brushing part done, then you can go ahead and turn on the suction and suction that out of the mouth. You don't want to do that while you're brushing, otherwise you're just sucking up the toothpaste and you're not actually getting it as clean as you want to. So then once you have used that piece, you want to go ahead and apply this mouth moisturizer. So you have this little green sponge. You'll apply the mouth moisturizer onto the sponge. You want to make sure that you get inside the cheeks, the tongue, all inside the mouth, and also the lips. You want to make sure that you keep the patient's mouth moisturized as best as you can. Okay, and then the next piece that we're going to apply, or the next thing that we're going to use, is a suction catheter. So after 2 hours, you'll come back, you'll apply the suction catheter to this piece. You'll go ahead and kind of go a little bit deeper back into the throat to get those secretions out where the patients aren't able to cough them up. So you're going to go in and suction a little bit deeper than you could with this sort of like Yankauer suction. So that's what you're going to do with this suction. And then the last one that I have here is this sort of like a bendy suction. And you're also going to use this sort of like toothpaste, similar to what you use with the toothbrush. So these two, this is very similar to what you do with the toothbrush. You're going to make sure you're cleaning around the gums, the teeth, the inside of the mouth. You want to make sure that you're getting that nice and clean. And then it does have suction too. You can kind of see at the end, you can suction that as well after you've gotten done cleaning that. And make sure that you are getting all surfaces of the inside of the mouth nice and clean. And then just as before, you want to go back after you're done with this mouth moisturizer, getting all the surfaces of the mouth as well as the lips, because you want the patient's mouth to stay moisturized. So that would be how you would do oral cares.